So what we've done in Ventura County is we have partnered with behavioral health, public health, the medical examiner's office, the Office of Education, community groups, nurses, the hospitals, and we've all come to the understanding that we all have our particular role to play in this problem, but it's that working with these other organizations and coming to a collaborative approach and a collaborative effort to solving the problem of addiction and overdose death by really setting goals. And we have numerous goals in our work group in this collaborative effort, such as reducing overdose death by 50% from what our numbers were in 2013. We want to double the take-home naloxone kits that are out there so patients are not, when they do overdose, they can be resuscitated and hopefully get into treatment. And we want to have students to report less usage of drugs in their past 30-day drug usage. And we want to continue to arrest people for drugs, because let's not forget, in law enforcement, our job is to enforce the law. And we are still going to arrest people, we're still going to incarcerate people, we're still going to put drug dealers behind bars. And we have also included now to follow the drug overdose. When somebody dies from a drug overdose, we follow up in our county on every overdose death and also non-fatal overdoses to find out who the dealer was of those drugs. And then we arrest them, and if we can put a manslaughter or a murder charge on them or a drug dealing resulting in death charge on them, we will. And we're seeing significant prison sentences for those charges.
In this particular county, and it's a tremendous model, the Ventura model. And they had a doctor come to them and say, you know what, my practice is getting away from me. My practice, I'm very uncomfortable with my practice right now. I'm very uncomfortable with some of the patients, where they have gone and what they're getting right now, and I need help. And together, they're working together with law enforcement, with behavioral health, with other practitioners, helping them to get the patients still the treatment that they need, but keep it in a controlled environment where they're not going to suffer any sequelae or adverse effects.
So what we did in Ventura County is law enforcement in collaboration with behavioral health and all those other agencies that I talked about. We've been going out to every hospital, every medical group, anybody that will listen to us, and we've signed up physicians to utilize the database. We've taught them how to utilize the database. We've shown them why they should use the database. We've explained to them why they should reflect on their use of the database, and really looked at with them what their knowledge and their motivation and the organizational barriers were existing for them not utilizing the database, and to try and make it easier and really motivate them to get out there and use it so they write less prescriptions, they know what's going on in their practice, they catch doctor shoppers, they catch patients who are going down that slippery slope of addiction. So it's really reaching out to the physicians, because we have about 1,800 doctors and then another 1,800 prescribers in our county. So we've reached out to all 3,600 of those prescribers in Ventura County. We've also reached out to the 800 pharmacists as well and explained that they have a corresponding responsibility to make sure that every prescription dispensed from their pharmacy is done for a legitimate medical purpose. So it's been a very collaborative effort, and it's an exhaustive effort that's still ongoing, is to get the docs to utilize the Cures database. And there's even things that we've done mailers, we've met with them, we've given them stuff they can put in their office to have discussions with their patients about what the doctor is seeing in the Cures history and the PDMP history, so they can have that conversation. And we've done follow-ups and training. So a very exhaustive effort to get them to utilize the database.
But what's so fantastic about that is that sometimes for physicians or prescribers, dispensers, whoever it may be, sometimes it's that little push. Hey, you know what, they're afraid of a computer, they're afraid of a database. They go, oh my gosh, isn't that what computer experts do? And once they get that one little push, or not even a push, it's a little introduction, then I've seen physicians looking every patient every time almost. And it's not necessarily that they have to do that, but that is a great, we have that as a slogan. Every patient, every time saves lives.